Hi, everyone. Welcome to the Nurse Wellness Podcast. I'm Wendy Garber-Mayo, and today we are joined by Dr. Lynn Allchin, who has, over the past 45 years, worked in a variety of nursing jobs as a staff nurse, assistant director of medical nursing, outpatient chemotherapy, per diem med surg, academic teaching, and office triage. There have been jobs she didn't like, but have worked every day as a nurse. Dr. Allchin has been interested and involved in oncology nursing since the beginning. She began interested in palliative care and hospice nursing and attended ELNEC training in 2001. She has spent 20 plus years teaching nursing students in the academic setting in Connecticut and Arizona. Currently, Dr. Allchin lives in Connecticut, has 2 grown children and 1 grandchild and a cat. Welcome, Dr. Allchin, to the Nurse Wellness Podcast.
Well, thank you very much for inviting me.
Can we start off by you telling us what inspired your nursing career?
Oh, well, all I can say is it's all I've ever wanted to do. I was a candy striper before I was 16 because my parents used to have to drive me to the hospital to volunteer. And I applied to one university, got accepted into their nursing program, and the rest is history. I've just always wanted to be a nurse.
That is awesome. And you're currently retired, is that right? Or are you working per diem?
Well, yeah, I'm not working per diem. I am working, I hope to be working next fall at the University of Connecticut in the skills labs for nursing fundamentals, which I just love to do. So, but just 1 day a week.
Okay, no, that's awesome. And when you were working in the clinical setting, how did you manage stress? And I know this was before COVID-19, but how did you manage stress as a clinical nurse?
I think forming friendships, supportive friendships was one of the most important things that I could do. And if you look at my friends, almost all of them are nurses. And I think that's because we understand the stresses, and that when we, I want to say, bitch and moan to each other, it's confidential, and it's not something we would say to the general public. So I think having those supports of friendships and right before COVID, maintaining those friendships with time spent together. Maybe it's a happy hour, once every other week. Maybe it's going out to dinner, or on Saturday, there are certain friends who are free and we'd go to a museum on Saturday morning and then out to lunch, so maintaining friendships, I think, was the most important thing for me in how I manage stress. And then also on the work side, thinking about, what's important, what is the bottom line? And, so sometimes little petty things or little, extra assignments that I thought was not appropriate, like, really did it matter? So you just kind of shut up and do it, and not letting those things kill your spirit, and focus on that patient outcome or that patient care, and the family care, kind of helped me, deal with managers that I didn't particularly like their style, or coworkers who were unhelpful. The bottom line was what's best for that patient. And so I think that's how, I went inside myself and just said, okay, this little piddly stuff isn't going to change how I take care of my patient.
Yeah, so it sounds like you were continuously staying in tune with why you were there, right? Focusing on the patient, the caregiver.
Absolutely.
I think that's awesome that you can do that over the years. I was just talking to one of my other colleagues about, nurses revisiting their purpose. And I think sometimes we could lose focus of that when we're stressed, when we are working in an environment where we don't particularly like the management or leadership.
Right.
We lose focus of why we're there. So I think that's such great advice.
And I know this is old fashioned, and I'm not a religious person at all, but I truly feel I was called to nursing. I've always felt that, and that may be why some of these ups and downs have not swayed me from my mission, I guess, my purpose in being a nurse.
I totally agree with you because I feel the same way. There's nothing else I would rather do than
Mhm.
be a nurse, and not just a nurse, but a nurse with patients.
Yes,
It's something about being in a room with a patient and caring for that patient
yes,
one-on-one. It's so special.
it is.
So I believe that you're a nurse at heart, right? So
Yes,
even
yeah,
when you leave the hospital or bedside, you are still a nurse. You just have that innate ability to care for others. So
yes.
I totally agree with you on that. Now let's talk about nursing in, the age of COVID-19. What are your thoughts on nurses at the bedside during this pandemic? I know you've been watching it on the news, and you have been attending some, support groups for nurses. So what are your thoughts on that?
I think this is probably one of the hardest times in healthcare, and especially for nurses at the bedside. I don't think nurses are often recognized for the amount of work, physical and emotional work that we do. And all of a sudden, it seems the general public has started to understand the day-to-day. If you didn't have a nurse, you'd be dead. I mean, people are in the hospital because of nursing care, not for physician care or provider care. They're in the hospital for nursing care. And I don't think that that's often understood, that's why you're in a healthcare setting. You're an inpatient, whether it's rehab, long-term care, memory care, acute care. It's the nursing care that you're in there for. So I think this has probably been one of the most stressful times. And I feel for younger nurses who have not seen death occur on the units, and certainly not one death after another death after another death without time to process that. It doesn't take months to get to know your patient. You know your patient within 10 minutes of walking into that room. You are bonded to them. So that time frame doesn't matter. So I think a lot of younger nurses I think a lot of nurses in general, healthcare workers, are going to have post-traumatic stress from all of this.
Yeah, no, definitely. And I think you brought up something very important about nurses getting recognition now during the pandemic. And I think, they're talking about the media, highlighting stress and burnout. But those are things we've been dealing with for years,
Absolutely.
for years.
Absolutely.
And now everyone's talking about it like it's a new phenomenon
Yeah.
where
Yeah.
it's not.
No, we have always worked short. We have always, done overtime. We have always given up our weekends or an extra shift to cover, or, so it's something we have always done. You're right. And the media all of a sudden is like, oh, these nurses are working so hard. And yeah, we've always been doing this. Yes.
Yes, and I just believe COVID just amplified
Yes.
all of that, right?
Yeah.
So it
Yeah.
amplified stress, it amplified burnout, it amplified, the experience of working late and having, more patients who are acutely ill. So
Yeah.
I always highlight that, like, this is not a new thing for
It's
our
not.
profession.
It's definitely not.
And you also raised a good point about post-traumatic stress syndrome in younger nurses and even older nurses. I
Yeah.
think just the
Yeah.
rate of deaths in the hospital and the stress of it all, right? Because we come with our personal stressors. It's not just when we're on the unit, it's what's going on at home, what's going on with our kids, our husbands, and
That's a really good point. I was driving down a road with a good friend of mine, and he's got family problems. I've got family issues, and we're bemoaning that fact. But then we're thinking, we're really blessed. We've got roofs over our heads, food on the table, etc. And we looked out at the other cars, and he said every single car, somebody is under a lot of stress that we don't know about. But because somebody would look at us and say, oh, look at that nice looking couple, oh, they're out for a drive on Friday afternoon. What problems would they have? But you realize that everybody's got that personal stress that they bring to their work setting. I mean, yeah, you try to, but it's always there. It's always there, and everybody has it.
No, absolutely. And I think you brought up something earlier about the importance of community in the workplace. So it's important that we ask questions, especially during this time of COVID. How are our colleagues doing, right? So ask the questions, what are they going
Yeah.
through? Because as you know, suicide is high in our
Oh,
profession now too, right?
right. Which is so sad. I mean, so
Yeah.
sad.
Yeah. And what I like to tell people, nurses are people. So we have depression, we have anxiety, right? We have suicidal ideation, we
Yeah,
have high blood pressure, we have, arthritis.
right. Everything. Yeah, right. Because it's not like you were angels either.
Right.
I mean, we've got issues and divorce courts and kids who are in the hospital and everything. Yeah, we're just people.
Right. But we show up. We
Yes,
still show up to care for our patients and, care for our colleagues. So I
right.
like to keep that in the forefront, because I think when people see us or they think of nurses, they think of, we are superheroes. Yeah. Yes, we are superheroes, but
Well,
but
we do things that the normal person wouldn't even do for their partner, their
right.
intimate partner. I mean, we're in there up to our elbows in things that people don't do for each other, and we just do it. I mean, it's part of who we
Absolutely.
are. We do it without thinking.
Absolutely. And that's that heart work that we do, right? That nurse, being a nurse at heart. So it really empowers us to do things that you wouldn't even think of doing, right?
Right.
But if someone needs it, then,
You
and
just do it.
yeah, and I have stories of even working in the ER, taking care of, a homeless man. I'll just tell you the story really quick.
Yeah.
Homeless man came in, lived under a bridge, and we took off his boot, and his foot it had all this dirt, but it was like a cast. But I took the dirt off, the sock off, and cleaned that man's feet like never
Yeah.
before, not even thinking about what I'm doing, who he is. It was just so fulfilling, and he was just so happy that someone cared that much to take
Well,
the time
yeah.
to clean
I
his
mean,
feet.
because you just did it. It's part of who you are. It's part of what we do. And I don't know how I can separate me from the nurse. I am, I am, and I think sounds like you are too in that way. It's just that's the way you are. And you do it without, yeah, it doesn't matter. Homeless, lives in a mansion,
Absolutely.
what color, what religion, where they're from, their criminal background, you just do it.
Yeah, and talking to nursing students, that's what I always say. Nursing is a job of the heart. You can't do it for money. You can't do it for fame, because when you're in there, you're in there, right? So, um, so,
Yeah.
so kind of talking about PTSD and post COVID, what do you think institutions can do to really support nurses? Now, I'm a big advocate for wellness programs and initiatives, right, that institutions can implement for nurses. But of course, there's a cost associated with that. Can you talk to us a little bit about your thoughts on that?
Well, yeah, I have several thoughts about that. First of all, what is wellness? It's certainly not the absence of disease, but it's a feeling of well-being, I guess, mental and physical well-being. So that's different for all of us. You know, um, I said my goal for April was to walk 30 miles. And I had a girlfriend who looked at me like I was crazy. And she said, well, that's what I walk in a week. Well, her wellness is different than my wellness.
Right.
I'm just trying to get moving. So first of all, what would appeal to you as a wellness program might be different than what appeals to me as a wellness program. And to just offer like, a gym membership or, Weight Watchers. I mean, those are all wonderful things, but they may not appeal. I mean, a gym membership is like, oh, really? Not for me. Because remember, 10 miles is like a lot for me. So, but some people might appreciate that. So, it might be that hospitals or healthcare systems can have like a buffet and, I'll take this year, I want that gym membership reduction or whatever. This year I want Weight Watchers. Somebody wants the Weight Watchers being able to join, without paying for it. It might be that I want 2 extra days of mental health that I can schedule, that I don't have to call in sick and leave my coworkers short because I'm ready to jump out the window. I can take a mental health day, as an extra day and plan it like next Monday. I'd like to have, Monday off so I can attend to my own self. But those things are all expensive. Gym memberships, Weight Watchers, an extra day off is expensive. And I guess part of me thinks, and some of that already exists. I mean, Harvard Healthcare has Weight Watchers, and they have a small gym available. But the bottom line is, nurses do not bring in income. We use that income. I was reading something online, and I don't have access to an academic library right now. So I was just kind of cruising the different websites this past week. And, one article was RN labor costs make up 25% of all hospital expenditures annually.
Wow.
We're an expense. Now, granted, this was 10 years ago, so I don't really know what the current percentage is, but when you consider salaries and benefits, yeah, that's a lot for an expenditure when we are not generating resources for that hospital as a staff nurse. So where does that hospital system, whether they're for-profit or not for-profit, where does that money come from?
Yeah, you bring up two really good points. I think one is making sure nurses are at the table when decisions are being made about wellness and initiatives and what they want.
Yes.
And not assuming that it is a gym membership,
right,
or Weight Watchers or what have you. So I think that's first and foremost. Nurses need to be at the table when those decisions are being made. The second thing is nurses, I feel like we need to advocate for ourselves, right? The community you talked about before coming together, but how do we advocate so we can, let leadership know, one, what we need, two, regardless who's paying for it, because like you said, people come to the hospital for us, right? We are with them from the beginning they enter the ER to discharge. And even when they go to long-term care.
And on, yes.
Right.
Yes.
We are with them. So, how can they give back to us? So we need to advocate for that, opposed to, like you said, bitching and moaning about what we don't have. Like, how can we come together and really utilize our powers to implement things that we need? And another thing you said that really jumped out to me is taking a day off, but without feeling guilty. Because many times, that heart work we were talking about, we feel guilty calling out, not only for the patients, but our colleagues.
Right.
Because we don't normalize that. We don't normalize taking a mental health day.
Right. I mean, and, we're given really minimal vacation time. And in that vacation, PTO, paid time off, you've got to get all your doctor's appointments, all your own wellness, your mammogram, your colonoscopy, all of that done. And the colonoscopy is 2 days off, so there's 2 days of vacation time that's gone while you're not having fun. And you're right. How many times have you not really felt 100%, but you go into work because you don't want to leave everybody short? And you don't want people to say, oh, it's another Monday, she's calling off, kind of thing. I think we have a tendency to go in when we're exhausted, when we're not 100% feeling well, whether it's menstrual cramps or, you had a little food poisoning last night from that sushi, but, it's all pooped out and okay, I'm going to go in, but we do that. And because we know that if the unit runs short, then really the patients suffer, and it's not fair to your coworkers. and certainly not fair to the patients. But I think having more time off to be able to use, or I don't know. I mean, to me, that would be a bonus, to have a day that I could just say, I can't come in next Tuesday, or I'm going to take, right, and not be scorned like you're leaving us high and dry. And again, I don't know how that works. I don't know what the balance is, but I think our paid time off is minimal.
Yes, I have definitely showed up at work not feeling well. And,
Oh,
being home, like I shouldn't go, I don't feel well, but I have to, feeling an obligation to go.
right.
And now I think, we're talking about self-care and wellness, but it's really important for nurses to take a step back to really figure out what they need and honor self.
Yeah.
Because you can't function and really pour out effectively if you were not, well yourself. So I think it's something we are trying to really highlight for nurses and healthcare professionals, that it's important to take care of yourself. Like you said, your walk. So what do you need in implementing that so you can sustain yourself, right? Because when you're gone, someone else will be there. So we really have to slow down and honor ourselves.
Well, and the other thing is that, you say, when I'm gone, when I'm on leave or vacation, someone else is there. And that's true. But historically, we have not been overstaffed. I mean, we are not overstaffed. And sometimes I think, just one more RN on a shift could alleviate some of the stress and that mental stress, so that we wouldn't feel like tearing our hair out or changing jobs on a more frequent basis, because you always think the other hospital, the grass is greener on the other side. So of course that other hospital is going to treat me better than I'm being treated now. So I think sometimes that, and especially for-profit hospitals, their RN per patient bed is lower than non-for-profit or government hospitals, at least in the reading that I've been doing.
Oh, wow.
And other nursing personnel is less in a for-profit than it is for a non-profit or government hospital. And I sometimes I think some of the stress could be alleviated if we had better staffing.
Yeah, when you're talking about the staffing and stress, it makes me think about the nurses who are leaving the profession.
Yeah.
And tapping into various roles or starting their own business or going into insurance. So leaving the bedside, which leaves us, shorter, right?
Yes, yeah. As the demand is going up because of our aging population,
Mm-hmm.
We've got people leaving. Not only are they retiring as appropriate, but you've got younger nurses who come in, and within 5 years, they're like, whoa, wait a minute, this is just too much. It's just not what I bargained for. And especially if they're a new nurse during COVID, I can't even imagine how they're feeling.
Yeah, no, absolutely. I totally agree with you. So what are your thoughts on what nurses can do at a local level, at their hospital, at their institution, to help with this issue of shortage, wellness, stress? What can we do? What are some suggestions you have for nurses out there listening?
Well, I do think, and again, this is a time constraint issue, but a journal club on each individual unit, and to look at research about stress, about staffing, and RN to patient ratios. I mean, there is some research out there, and if the nurse manager or the clinical nurse specialist or whoever can pull that together, that's one avenue of just informing the staff about what research is out there and what it says. So then you're going, you're stepping from like the nurse manager, the clinical nurse specialist or clinical educator for those units, and so you're taking it down, into the trenches, but it also has to go up, because those are the people in upper management who are going to be making those decisions. But, if your nurse manager is not on board, if he or she doesn't see the need for, better staffing or more time off or gym memberships or whatever it is that her staff have talked about, it's meaningless. It's a waste of time, so you've got to have buy-in from the main players about what's important and, and what can we let slide. Staffing and stress management, to me is essential. And maybe it's seasoned nurses being mentors, not necessarily on the same unit either, because sometimes you can't talk, you don't want to talk to someone who's above you, who's like orienting you because like you're ready to tear your hair out because it's not what you learned in nursing school, but it's the way she does or he or she does something, so maybe mentorship from different unit to unit kind of thing, just to vent, just to say, how are you doing? What's going on with you? Are you taking care of yourself? What are you doing for fun when you leave your shift? On your days off, what are you doing? Are you sleeping all day, or are you out playing, doing your grocery shopping? Are you going to the movies? Whatever. And encouraging that self-care from the get-go. I think student nurses too need to be encouraged to take care of themselves, to do things that they find satisfying and fun. Even when they're in nursing school and they think they don't have a minute to breathe, they need to take time for themselves, and they need to be encouraged to do that, so that that's a routine that they're used to. And that doesn't mean that I don't work Friday nights because I go to bingo, which I've heard happened in an interview. That's not exactly what I mean, by taking care of yourself. So I think, and you have to have buy-in. I mean, you have to have buy-in from staff who says, yeah, we can change this. Instead of, oh, this is never going to happen. We're always going to be like this. It's always been like this. You have to have staff who's willing to say, yeah, but if we all come together and ask for this, we might get it. It's possible, and we can show them the documentation. We can, so you have to have buy-in from everyone that this is a useful use of our time to look at what do we want, what is the staff needs, what are the needs, what would make us feel more confident and competent in our role.
Yeah, and two things that you said. One is buy-in. So there is research out there that stress and burnout lead to issues with patient safety.
Yeah.
And I think any healthcare institution, that should definitely make your ears perk up. That burnout and stress lead to, patients not being safe.
Right.
Also leads to decreased quality of life of staff and patients. Yeah. So our surveys, looking at, the surveys that we do, Press-Ganey scales, those will definitely be impacted by stress and burnout. So those are the things we need to be bringing to the forefront to leadership. Yeah. To really, show them that this is why we need X, Y, or Z in place. Right. So we can, function better as nurses.
And maybe it's something as simple as 60-minute lunches instead of 30-minute lunches, because a 30-minute lunch, you can't do it. You shove food down, or you run to the cafeteria and run back. And by that time, your 30 minutes is done. There's no time to go outside and take a walk and eat.
Well, that's even if you're taking a break.
Right. Well, that's true. But yeah.
That's a whole nother story.
Yeah, it is a whole nother story.
Sometimes we're not even going to the bathroom. We're not going to the bathroom. We're not eating. We're not drinking.
Right.
I mean,
right. And right. That's a whole nother thing. And that's not self-care. Not eating lunch, not using the bathroom. That's you're sabotaging yourself.
absolutely.
And so we have to somehow get it through our heads that taking a lunch break is not anything unusual. We should all be getting a lunch break. And I'm all for the 60-minute, but because it's a 30-minute unpaid lunch break. So they'd be paying you for 30 minutes of your time. I think that's worth it so that you can take a walk around the block or sit and meditate or sit in a room and do some yoga stretches, or call your elderly mom, and say, I'll be able to touch base with you in the middle of the day, or the babysitter, to relieve your mind. And so that you're not in the back room trying to, whisper, Mom, are you okay? But again, it's every unit's got to decide, but we perpetuate that. It's like, I was reading somewhere, it's like a badge of honor, like pat yourself on the back. You didn't need to eat today. You didn't use the bathroom today. Ooh, I am woman. It's like, no, you need to take care of yourself so that when you get home, you don't fall from the shower into the bed, that you're able to enjoy your family or your friends, or just take your dog for a walk, and not, feel so tired because you haven't eaten all day. You haven't had any fluids for most of the day. You might have had a cup of coffee, 2, 3, 4 cups of coffee, but that's it. So you go home feeling dog tired and stressed. It's not a badge of courage to say, I didn't get lunch today.
Absolutely.
It's not. But we do that.
No, that is so true. And I think you and I had a conversation about just nurses, right? So that's normal. We normalize stress. We normalize not eating. We normalize taking on 8 patients. It's like, oh, I did it, right?
Yeah.
We normalize that. So we have to really break that habit and really tune into ourselves. So
Yeah.
I always think about it, honoring yourself, right? You honor the patient, you honor, your coworkers. When do you honor yourself? When you advocate for yourself, I need a break. I need to use the bathroom.
Yes.
I need to have some water. That's honoring yourself.
Yes, it is. And we don't do that, and it's the same way with taking, 2 more patients than you're normally assigned. That's not safe. It's not safe for you, and it's certainly not safe for your patient. But what do we do? Yeah. Oh, pat yourself on the back. You took 8 patients today, and an admission, and a discharge, and a fresh post-op, and your blood was running, and how good was your care? How good was your attention to detail when you're stretched so thin? So that's not something to be proud of. I mean,
No.
In an emergency, absolutely. On a day-to-day basis, absolutely not. It's just not, it's not safe. It's not safe.
And I also think when it happens, we need to go back and really unpack what happened. Because sometimes we take on the 8 patients, we don't get lunch, we don't use the bathroom, we don't drink, and we come in the next day and like you said, we're patting ourselves on the back, but we never talk about it.
Yeah.
In a constructive way of how can we prevent this from happening again?
Yes. Yeah. Why did this occur? What happened? And how can we prevent that? I mean, where's the float pool? Where's the nursing where's your nurse manager advocating for you? Where is the supervisor who's making all these assignments and knows that, unit A has an extra staff member? Where was the failure to communicate? And again, there's always emergencies. You have to bend over backwards and you do what you do. But we've made it such a routine event that we just don't think about it, and it's except to grumble about it at the end of the day. And then the bottom line is, did you clock out on time?
Right. Because when you don't, I'm sure they will bring you into the office to unpack that.
Right.
Right.
Oh yeah, and I, as a per diem, I used to it took me longer to do stuff, and it was like, Lynn, you can't be clocking out 20 minutes late. I'm like, okay, I'll do my best, but to me, it was worth that 20 minutes. Don't pay me, that's fine. But yeah, so anyways, but yeah, you're right. You got to clock out on time. You got to clock in on time, clock out on time. And if you don't, right, you're disciplined for being late a few, 3 minutes or 5 minutes, whatever it is, and going over. You're disciplined for that. But nobody's, and now you have to attest that you got a lunch break or not, at least my last job. Well, all hell breaks loose when you didn't take it. Why not? That's unpacked. But because then they have to pay you those 30 minutes.
Oh.
Yeah, they have to pay you. If you say I did not get a lunch break, they have to pay you for those 30 minutes because you were working. So we got in trouble if we clicked that and didn't take a lunch break. Well, I'm on the phone, I'm on this. Well, couldn't one of the medical assistants have done that? Well, no, they can't do pre-op teaching. No, they can't do triage, So you lie and say, oh yeah, I took a break, even though it was just 15 minutes at my desk.
Right.
Which is awful.
Yeah, and one thing I like to, remind nurses is that we are so powerful. We have so many other specialties, characteristics, abilities that we can bring to our job, whether it's leadership skills, whether it's time management skills, where we have to share, right? So in advocating for ourselves and our tribe, as I like to call it, our other nurses, tap into those. Don't just take it, right? If you have a better idea on how things can be done, if you have a streamlined process, if you have suggestions, or you've done something before that showed positive results, share that. That's the innovation, of healthcare and what we do. So I
think that's important, Wendy. And I think people are hesitant, not only nurses, but in general, in many jobs, are hesitant to say, hey, have you ever thought of doing it this way? Or, I tried this and this worked. Because people will say, well, that's not the way I do it, or we've always done it this way. So yeah, you do what you want, but this is the way so I think there's pushback from seasoned people, that people have to be open to change. Change is really scary. And, so I might say, gee, you never, ever, nope, don't like that. So I'm shot down. So do you think I'm going to try again and again and again? So, you have to be really brave to share those things. And we have to be accepting of at least listening to our colleagues.
No, absolutely. And I think nursing leaders come into play, because a good leader, you empower your people to be innovative, to be part of the solution. So our nursing leaders who are listening, we want to empower those nurses on the floor. And I call it the added value. Tap into their added value and see how that can really positively impact the environment, especially during this time while everyone is under stress. Anything that someone's doing that's helping, we should be able to, 1, at least listen to, 2, possibly try, right?
Yeah.
And 3, evaluate those outcomes. And 4, maybe it can be a standing SOP or way we do things. So I think that is very important. As leaders, we need to empower our nurses who are brilliant and come with so much experience, not just nursing experience, but
these
life
are
experience.
Smart women and men.
Absolutely. Totally agree with that. Lynn, you also said something else I wanted to hone in on. We talked about our nursing students. I have been an advocate of us really incorporating stress management, resilience, and self-care into the nursing curriculum. What are your thoughts on that?
I think it's valuable, and I don't know where it, just off the top of my head, it kind of fits in every course, which means it's going to get lost. And then I think, I know what other people are going to say, like, oh my God, one more thing to add to the nursing curriculum, when really it's not adding, it's just, it's more informing. And I mean, I've seen, instructors in, large classrooms walk in and say, okay, we're going to take, 3 deep breaths, and she has quiet and everybody, and kind of centers themselves for the class. That's great, but you've got to have either people be quiet and just sit there. Hopefully they'll participate. You don't have to, but at least honor everybody else and just be quiet for a minute while this is going on. So you've got to have that buy-in to have it hopefully be successful. So I've seen, I've heard of professors doing something like that. I encourage when I have skills labs, and I've got 8 or 16 students in a lab, I try to end the session by saying, I want you all to go out and have fun, do something fun this week, and then try and ask some people the next week, well, what did you do for fun? And when one fellow said, well, I guess the only thing I did was I did go home, to see my folks, and I got to play with my dog. I said, fun. You got to relax. You got a home cooked meal. You got loving from your dog. Perfect. I mean, you don't have to go to a circus or, a movie marathon to have fun. It can be just that simple, and once they start understanding that it doesn't have to be a monumental, I went for a walk, with my roommate the other day. We walked around campus and looked at the lakes, and, I went and called, my grandma, and, got caught up with her and grandpa, those kinds of fun things that don't have to take a whole day to do. So I wish we could, and I do think that it's being realized now because of the COVID stress and strain. These nurses, I mean, right, it's not new, but all of a sudden it's in the forefront of how do we take care of ourselves so that we can get through this kind of world crisis. And that's what it is. It's been a crisis of magnitude that we have not seen in most of our lifetimes.
And I also think, having something like self-care, stress management, resilience in the curriculum, like you're saying, it's small things. So taking a deep breath. But I mean, if in each, course, they're telling you something, right? It takes a little bit of time, whether take a deep breath or just sit quiet or visualize something. I think it's important. And I would love to see research if that was implemented in the academic setting. How do those nurses handle stress in the clinical setting?
Right. What's the follow through from that? Are they better prepared to do self-care in the real world? Yeah, that would be really interesting to know whether they're attuned to, themselves better of like, when do I need some help? And yeah, that would be really interesting.
Yeah, because there's a lot of research that we all know, nursing school itself is stressful.
Oh my gosh, yes.
So it will benefit them currently, right? In going through the program, and maybe even increase success rates of people finishing, because many people start nursing and they just can't finish because the curriculum is so rigorous, right?
Right.
So stress management may help with that, but also, going into the nursing field that is stressful, but more stressful, right? Because we're in the midst of a pandemic, but it can help them there. So I think it's something that I hope they're talking about in the academic setting.
You know, that's really one of what you make me think about. It's a life skill. I mean, you know, it really is a life skill. And while, yeah, teaching it to nurses, to nursing students is beneficial, really everybody in high school should be taught this kind of stuff, you know,
Yeah.
and so we're kind of late to the show here, but I still think it's very worthwhile, especially in caring professions, to know how to care for yourself as well, because I think sometimes we just, right, we go in when we don't feel good. We go in when we're exhausted. We pat ourselves on the back for not taking a lunch break. So we need to recognize that taking care of ourselves isn't always going on a week's vacation. It's the everyday things that we do. We eat well, we hydrate, we walk a mile a day, whatever it is, those things, we take our dog for a walk, we cuddle with our kittens, whatever, that those things can help maintain us through these excessively stressful times and the normal stress that occurs with being an adult.
No, absolutely. And, during the last nurse wellness workshop, we had breakout rooms. And the question was, who taught you about stress management? And it's not something that's taught.
No, not, I don't think not in school. It's not, I think you may pick up a book at the bookstore, by word of mouth. You kind of know that exercise is good for you, but yeah, it's really like a self-learning. And yeah.
And
what they do in grade school for stress management.
Yeah, and we start to adopt things that, our parents did or how they manage stress, which may not always be the best,
right.
But it's something that I think, like you're saying, we need to start early, like really teaching our kids the importance of self-care and stress management.
Yeah.
Before we wrap up, Lynn, I would love to take you through a rapid fire. Is that okay?
Sure, go right ahead.
Awesome. This has been great. Thank you so much for your time today.
Oh, well, you're more than welcome.
All right. So let us know the first thing that comes to your mind to finish these sentences.
Okay.
Wellness means
being healthy as defined by me.
I know I'm stressed when
I start eating for no reason.
My go-to stress management solution is
food. Yeah, that's embarrassing.
No, not at all. I mean, stress is associated with increased appetite.
Yes,
for sure. The last time I had a belly laugh was?
Oh, this morning.
Can you share?
Well, the guy I'm seeing, I went to visit and I left some articles of clothing there, several by mistake because they were like in the laundry basket and I didn't pack them with me. So he did the laundry and found these articles of clothing. And today he was going out running and pulled open his drawer and there was this article of clothing of mine. So he took a picture of it and said, woohoo, look what I found.
That's awesome.
Yeah, yeah, I laugh every day. It's I guess that's one of my best stress relievers is I love to laugh. I mean, it's just because things are just hysterically funny. Because sometimes if you don't laugh, you cry. I mean, it's just things are screwy.
Absolutely. And stress is. I mean, laughing is a good stress reliever too. So.
Yeah.
So and that can be a whole nother episode, leaving article of clothing. We'll have to talk about that another time.
And I will never divulge what article of clothing you found.
And our last statement is, one thing I have learned about myself during the COVID-19 pandemic is
that I really am self-sufficient.
Love it.
Yeah.
Awesome. Awesome. Well, thank you so much, Lynn, for your time. Really appreciate you being here.
Anytime, Wendy.
We can bring you back again.
That'd be wonderful.
Okay, bye-bye.
Bye.